Ashley Hightower. I'm a physical therapist assistant student with Jeff State Community College. And today what we're going to be talking about, irritable bowel syndrome. So if you don't know anyone that might have that disorder, you're going to find out a little bit about it today. What it is an intestinal disorder that causes abdominal pain, discomfort, bloating, and diarrhea, or can cause constipation. It is considered a disorder that affects the function of the intestines but causes no structural damage, so that's why it's a functional disorder. The cause of irritable bowel syndrome is currently unknown, but like I said, it's altered functions of the gastrointestinal tract. These altered functions include GI tract motor activity, visceral hypersensitivity, serotonin levels, bacteria imbalances, and intolerance to dairy products and other sugars. When we're looking at the GI tract motor activity, what happens is the muscles of the colon or large intestine, the contractions can move too fast and last too long, causing the individual to experience diarrhea, or the contractions can not last long enough and it will cause constipation. And then the symptoms for irritable bowel syndrome are used to identify if someone has this disorder, because there are no tests to identify if someone has it. A prolonged group of symptoms are used. Abdominal pain or discomfort must be present for 12 or more weeks, but these weeks do not have to be consecutive. And then there also must be 2 additional symptoms present, such as abdominal pain and discomfort that is relieved with a bowel movement, change in the frequency of bowel movements, and the consistency of the stool changes. Other symptoms used to diagnose this disorder include urgency, straining, a feeling that the bowels cannot be completely emptied, mucus found in the stool, and a bloated feeling. There are also triggers for irritable bowel syndrome that will cause a flare-up of the symptoms. These include emotional or psychological stress, fatigue, smoking, alcohol consumption, consuming foods high in fat, roughage, or fruit. And then there are what they consider red flag symptoms when looking at this disorder. In addition, it might call for additional testing to make sure that there are no other possible problems for the symptoms that are happening, such as unexplained weight loss, bloody stools, nausea, and new onset after 50. Okay, who gets irritable bowel syndrome? It is the most common GI tract disorder. It affects up to 20% of the U.S. population. It can occur at any age and in either gender, but it is much more common in women than men. The symptoms of irritable bowel syndrome usually begin in early adulthood and last throughout life with periods of remission. So there'll be times when you'll have the flare-ups that might be caused by a trigger, and then there'll be times when the symptoms aren't as, they're more tolerable. It is not a life-threatening disorder, and the symptoms can be controlled through diet, exercise, medication, and stress management. When looking at irritable bowel syndrome, the treatments that are used, they control more towards controlling the symptoms, like relieving abdominal pain and discomfort, stabilizing your bowel movements, and treating the underlying causes of this disorder, whether it be the serotonin levels, the GI tract motor activity, and things like that. An individual with this disorder may have to make lifestyle changes, such as taking medications or participating in behavioral counseling or psychotherapy. Diet is a major contributor to reducing these symptoms. Staying away from dairy, alcohol, tobacco, gas-producing foods, and caffeine may be helpful. Individuals that might be experiencing the constipation side of this disorder might need to increase their water and fiber intake to help move that along. It's very important to keep those bowel movements normal, because once that sets in, it's really hard to get rid of those symptoms. Antidepressant medications may also be used to reduce their visceral hypersensitivity, because individuals that are experiencing that, they're overly sensitive to what's going on in the digestive tract. Individuals that may have disruption in their serotonin levels, they're now being prescribed serotonin modulating agents to inhibit the actions of that neurotransmitter. Other medications may be prescribed to take prior to meals to help control the symptoms, such as gas, bloating, abdominal pain. More research is trying to be done to individualize the medications for each patient's specific symptoms, because everyone's going to have different issues. Treatments for irritable bowel syndrome, there are different programs that might be effective in controlling the symptoms also, such as relaxation techniques for the individuals who are having overactive motor activity in the muscles. Exercise is effective, biofeedback, psychotherapy, and hypnotherapy is also used in an attempt to control the muscles of the GI tract and the reaction to stress and other influences. Some impairments that irritable bowel syndrome causes: pain in the abdomen, swelling of the abdomen, and uncontrolled bowel movements. There also are functional limitations. Individuals that have this disorder, they aren't allowed to consume certain foods because of the possible increase in their symptoms, such as they have the triggers that cause the flare-up in symptoms. Disabilities caused by this disorder include the inability to participate in public functions due to their inconsistent bowel movements and abdominal pain that they may be experiencing. Also, they may not be able to perform activities of daily living due to their frequent restroom breaks, because they may be having diarrhea. Also, physical therapy can be very beneficial for individuals with this disorder. Relaxation techniques can be used, such as breathing exercises, and hot packs can be applied to the lumbar regions and the abdominal regions to help those underlying tissues relax. Individuals who have constipation, they may need some therapeutic exercises to get their muscles moving and active, such as the treadmill or the bicycle. And it just helps the mobility of that GI tract. And when doing physical therapy with an individual who has this disorder, they may need frequent rest breaks to not exacerbate their symptoms, and they may also need frequent restroom breaks depending on how their symptoms are right now, to see if they have flare-ups or things like that. Also, when doing physical therapy, you want to make sure, if you're working with someone who has irritable bowel syndrome, you want to ask them to make sure that they're not having bowel incontinence, because if you're doing hydrotherapy with this individual and they have bowel incontinence, that's a contraindication to perform therapy in the pool or whatever might involve water. Irritable bowel syndrome may not be a life-threatening disease, but it can be very debilitating to the individual who has it, because they're not able to perform their daily activities, and it's really limiting their life. And hopefully, through research and everything that's going on, they'll be able to individualize their treatment so that their symptoms are taken care of for their personal self. And I also have a video for you to watch. Okay, so when their motor activity is affected in the colon, the muscles are contracting too fast and lasting too long, causing the bile and the intestine to move through too quickly, and less water is absorbed. So it makes their stool very watery and loose, and that causes diarrhea. And then also, if the contractions are not strong enough and they don't last long enough, it causes constipation, because too much water is drawn out of that stool and absorbed. So it causes constipation in the bowel, and they experience pain from that because they're not able to go to the restroom. That's all for today. Thank you so much for listening to me. If you have any questions, just let me know and I'll get to those. And just thank you very much.